Good morning or good afternoon to everyone. First of all, thank you all for being here, and we hope you find it good, this webinar of You Care for You. Today we're going to talk about different types of induced urticaria. My name is Dr. José Ignacio Larco Souza. I'm from Lima, Peru, and I am a member of You Care. And now I will pass to Dr. Natasha Teovska. She is a clinical dermatologist of the You Care Center at Remedika General Hospital from Skopje, North Macedonia. And she will talk now for cold urticaria.
Yes, thank you, Dr. Jose, for a nice invitation and a very nice introduction. I'm so happy that once again I'm right now a speaker. I was last time a moderator. So today I'm going to speak about cold urticaria. So I'm so happy that I'm a dermatologist coming from Remedika General Hospital from Skopje, North Macedonia. And these 3 months we already UCare, part of the UCare network. So every time we have questions, we have patients coming to our department. There are so many questions that are sending to us as a doctors, as a dermatologist. And I put most of the question that the patient are trying to get the answer. So what is the cold allergy or cold urticaria? Is it the same? What is the cold urticaria and what are the symptoms? How rare is the cold urticaria? What triggers my condition? How long it will last? How is the diagnosis made? What is the temperature test device? And what are some lifestyle modification you can make to prevent this type of urticaria? So this is the most common question that we have every day as doctors from our patients. As Dr. Jose already mentioned, the classification of the chronic urticaria subtypes. So I'm going to speak about cold urticaria, which is actually a subtype of the chronic inductible urticaria characterized by wheals or angioedema or both that can occur after cold exposition to the skin or to the mucosa. This cold urticaria can also induce cold-induced anaphylaxis, which is very severe reaction and it's very serious as a reaction. And what can we say about diagnostic difficulties that we as a doctor have with some atypical form of cold urticaria? So we have sometimes difficulties when the patient are coming and say, okay, I have cold allergy. Is it a cold allergy or is it a cold urticaria? What we can say, it's true that cold urticaria causes precisely the same symptoms as the allergy, but it isn't a real allergy. So the term cold allergy is not just misleading, it's incorrect. So just to, okay. So one simply cannot be allergic to cold. So we know that for the allergy, it needs an allergic reaction. That means an allergen that is coming from outside, or we have this allergen in the body. And this allergen is usually make allergic reaction and provoke antibodies. Because there is no antibodies that can be formed against cold, there cannot be anything properly called a cold allergy. So what are the symptoms when you have a cold urticaria? So the number and the severity of the symptoms, it's usually verified from person to person. So the most common symptoms is the redness, is the erythema of the skin, usually presented if the patient is touching a cold, let's say a cold place, or touching some cold drinks, or something which is has something that can induce these symptoms is usually presented like on the hands, this acral swelling. It can start to be pruritic. It can start to be itchy. So it will present with these hives, which can be present with welts or wheals, with or without angioedema. That means you can see the pictures how the cold urticaria actually looks like. But other things that we have to mention is that this patient, they don't have only these symptoms, but they also can develop symptoms including anaphylaxis reaction. That means it's not involve only the skin with hives, with swelling, with itching and redness, but also can be manifested in the respiratory systems, in the gastrointestinal systems, cardiovascular and neurological. That means the patient can have all these symptoms, including not feeling well, wheezing, shortness of breath, chest pain, so trouble with swelling and fever-like symptoms, like symptoms of stomach pain, immediately nausea, cramps, diarrhea, vomiting, or cardiovascular symptoms, because it can start to collapse and dizziness, start to be pale in the skin tone and to have a weak pulse, and to, of course, and also to have neurological symptoms between like anxious feeling that it's something will happen bad with this condition. So we have to be aware of also of these symptoms that can happen to the patient. As a doctors, we have a classification for cold urticaria. It can be typical one and atypical one. Typical, that means to the local cold stimulation test that we use as a doctors. When we do this test, we actually see this urticaria when we do the test. Usually this local cold stimulation test on the forearm with an ice cube or the temperature test technology, and usually resolve within an hour. Or a typical cold urticaria, in which other provocation methods are needed to produce wheeling, like general body cooling or local, let's say, cold stimulation tests produce a typical response, and also cold-induced anaphylaxis. So all the time, there are another question: how rare is this condition? The incidence of this cold urticaria is estimated around 0.05%, with the higher rates in the cold climate countries. For my countries, we don't see it very often, although we have a very, cold winters. Frequently, statistically, is seen in women, and it's usually in the 2nd to 4 decades of life. It has long duration of severe years of average between 5 till 8 years, with remission or improvement of the symptoms after 5 years in half of the cases. So I put some pictures because you're all patients that you want to know about this condition, and you usually ask about what is the triggers. I think this is the most important question for us as a doctors, because this is the first thing that we have to educate you. What triggers this condition is this cold object or surface, where you touch this cold surface or cold object. Cold water, swimming, or taking cold showers, low ambient temperature, that means cold seasons, air conditioning, then wind also, and consumption of cold foods, ice cream, or cold drinks and beverages. And also what we have in the hospitals is administration of the cool infusion solution, of prolonged surgical intervention, including hypothermic cardiopulmonary bypass surgery, or some cosmetic procedures when we apply something which can provoke this situation. So as a doctor, we still doesn't know what is the pathogenesis, what is the actually mechanism, what is happening in the cold urticaria. But of course, there are a lot of, it's postulate autoimmune mechanism, but what is clear is the same. This is a very easy picture to see. Is this the triggers is actually the cold. And during this cold, when this cold, they do the reaction with the mastocyte, which is the cell that actually is the first line border. If we are seeing like a firefighters, actually this mastocyte is then making a reaction and making a substance like it's a messenger. We say histamine. As a mediator, it's released by these mast cells and goes to your blood vessels and causing to become wider. And this makes much easier for all these white blood cells to get into this area and to cause the release of the fluid from your blood vessels into your skin. So in this, actually, this fluid is presenting or angioedema or hives. It's if it's presented in the superficial derm, then it's presented as a wheal. If this fluid is going deeper, then you cannot see the wheals, but you can see edema. So, but not only this histamine is going out as a messenger. There are a lot of mediators, there are a lot of substances that are also involved in this process. So the mechanism, the primary acquired cold urticaria is these mast cells, as I already mentioned, are activated by this cold stimuli and release of the histamines and all these pro-inflammatory mediators that leads to this, I say, like a circle, pruritic, wheal, and flare reaction that makes this to increase the blood flow, to increase the thermal warming, to increase the vasodilatation, and of course, all these symptoms that you will see as a patient. The triggers of cold urticaria, these mast cell activating signals in the cold urticaria has not been well defined and are likely to be heterogeneous. So there are a lot of variants of atypical cold urticaria that includes systemic atypical, localized cold urticaria. This is more for the doctor's issue when we categorize patients if this is a typical cold urticaria or this is a typical cold urticaria. This will help us in the therapy and of course with how to access the patient after that. So I will not go through all these variants of the typical, but it's worth to mention that we have systemic atypical, localized cold urticaria, localized cold reflex urticaria, delayed cold urticaria, cold-induced cholinergic urticaria, and cold-dependent dermographism. So clinical presentation, we have all these conditions in cold urticaria patient that I already mentioned, and especially the severe one, which is the cold anaphylaxis, that we should also mention as one of the reaction of the cold. Another issue is that the clinical presentation is usually dependent from the potency, and it's also dependent from the if it's presented early in the adolescent form. Also, it's dependent from the duration of the cold exposure. Also, we are always thinking about individual cold sensitivity thresholds. So I'm going to mention the classification also for the cold urticaria, which is the primary acquired urticaria, that symptoms may begin in 5 to 30 minutes. And I already mentioned the symptoms. It's itching, it's reddening, it's burning sensation, headache, wheezing, heart palpitation, and fainting. We have delayed cold urticaria that symptoms may not start until several hours. We have localized cold urticaria that is already previously occurred or where injections for allergens have been administered. We have reflex cold urticaria, which is localized area of cold applications such as a playing up of ice pick, and hereditary familiar form that is usually take approximately 24 to 84 hours to appear and last longer, usually around 24 hours, than symptom lasts in the acquired essential form of cold urticaria. We split the clinical manifestation as a primary or secondary cold urticaria. Why? Because sometimes the patient can develop the cold urticaria and having another condition, which is infections, which is something that it's correlated with the immune system. So we have immune-mediated disorders then can provoke this kind of condition. So usually when we give the therapy for all these conditions, these cold urticaria symptoms will disappear. So that's why we need to mention all these issues. So this is the classification of cold urticaria. I will not gonna go through because we already mentioned, but it's very easy to see the provocation time and how we split the cold urticaria as a typical one when we do the how to say, diagnostic procedure with cold exposure, even if it's an ice cube test or the temperature test. Then we see the whealing and itching. If it's a typical one, it can be with a typical urticaria response, or it can be have a typical cold stimulation test with an atypical urticaria response. And of course, it can be also present as a typical cold stimulation test with an atypical urticaria response. So it's not very easy to classify the patient and to see and to say, okay, you have a cold urticaria, and this is we're going to give you the therapy, and the symptoms will stop immediately after with the therapy. So when the patient is approaching to the doctors who are actually treating the cold-induced urticaria, we do some diagnostic tests. Between the tests, we also take some investigation regarding the symptoms that the patient has it. So sometimes the patient has not only this cold, that doesn't have only these symptoms that I previously mentioned between the wheals, or something which is correlated as a reaction of the cardiovascular respiratory system, but also can have headache, can have arthralgia, can have high temperatures. So in order to see if it's a cold-induced urticaria, we can take blood specimen and to see all these, let's say, markers, and to make the diagnosis for the patient. So most of the patients that are coming with urticaria can also have another form of urticaria. That means can have a cholinergic urticaria, can happen also solar urticaria, can also have a history of asthma. You see 46% of the patient that has cold urticaria can have also an asthma, can also have an allergic rhinitis, 50%, and also can have an atopy. Still, the mechanism of all these conditions and cold urticaria is unclear, but we have to mention that the patient can have this condition together. So, as I previously discussed, how we diagnose the cold urticaria. The first one is the ice cube test. That is really an easy test that we do. It's actually an ice cube in a tiny plastic bag or non-latex medical glove that we apply to the forearm of the patient for 5 minutes, and then we follow the test reading 10 minutes after the end of the cold stimulation. So the positive result is demonstrating by the whealing with or without itching in the contact area with the ice. Right now in my hospital, I'm doing this test. Sometimes we don't have a positive reaction of this ice cube test, and maybe we can do continue with other testing like immersion of the hand or infrared thermography of 3D-dimensional volumetry imaging. So this is how it looks. This test is very easy to be done. We wait 5 minutes, and then the whealing will come. And of course, if there is a more severe reaction, then you will see this spreading of this erythema, spreading of this whealing, and we say it's really a big reaction of the patient. Another thing that is also very sensitive and very specific one, and it's not only this cold stimulation test, but there is also a very nice temperature test device that is actually very specific for the patient. It's actually a novel and validated instrument for the temperature test measurements, and it enables to objective quantification of the severity of this cold urticaria. And of course, we have a lot of information after this test, because this is actually aluminum stencil we put the patient, actually, if you can see on the picture, actually the forearm of the patient is laying down on these temperature tests that is on the aluminum stencil at the device for 5 minutes, and this is of course this stencil applies a temperature range from 4 to 44 Celsius degree. So this temperature test device is actually specific calibrated cold temperature stimulus directly to the subject's skin, and it uses the Peltier device, and it's very standardized cold stimulation. But if we use like ice or other cold stimulus, does not provide a standardized and temperature stimulus. And of course, if we do immersion of the hand of an icy slurry, we have to be aware of the inducing systemic reaction. So based on this temperature test methodology, we actually is helping us as doctors to identify this patient with a high risk of the anaphylaxis, who are likely to benefit from the early prescription of epinephrine autoinjection, higher dosage of antihistaminic, and the treatment with biologic. And in actually, this testing is giving us the picture to monitor our therapeutical intervention, and of course to assess the activity of the cold urticaria and to develop personalized treatment plans for all these patients. So this temperature test device, we actually have this cold stimulation temperature, which is the highest temperature that induces a wheal, and we have something that is critical stimulation time thresholds, which is defined as the shortest time that is required to induce a wheal. And usually this cold temperature is correlate with the severity of the patient. So first aim of this diagnostic testing is to confirm the cold urticaria by performing this very simple cold provocation testing. And if it's a positive, then it's developing the urticarial skin lesion at the sites of the cold challenge, and it's most common, as I previously say, it's the application of the ice cube to the skin. The second aim, as I already say, is to determine disease activity and to monitor response for all this intervention for the therapy. So this is how it looks when we put the patient, let's say, the information for the testing. So we put the test, the temperature, when the wheel came, and of course, this is actually for us as a doctors, the best, as I previously say, the best, it's something that will help us, especially for the patient who are very difficult, who have a typical response of these tests, or if we have a patient who will develop cold-induced anaphylaxis. But we have to take care also and to think about the condition that can also have this, of course, urticaria, and it has to mention that all these infections that I previously discussed, autoimmunity disease, lymphoproliferative disease, drugs, foods, and insect, that can also, we can see with of course, cold urticaria, but also we have to think about two, let's say, condition that can also have during generalized cold exposure or during the ambient temperature less than 37, can start with wheals, can start with angioedema, and can have the same reaction. So that's why we have to follow all the guidelines. We have to do the diagnostic testing or to do some screening for the patient. So other evaluation, if we have a cold patient with a negative cold stimulation tests, then we do this need further evaluation. If the test takes more time, then we can do the longer provocation time, up to 20 minutes. We can do in order to have the picture of wheeling, to have the picture of urticaria. We can do soft immersion of the hand. And as I previously say, with special cautation, with immersion of the forearm in the water, we have to take care of the time, not to go up to 15 minutes because it can present the cold-induced anaphylaxis. And secondly, other tests for a typical cold urticaria are also recommended. So preventive measurements, I always speak about these preventive measurements because if we know the triggers, it's much easier to say and to give the therapy for the patient. For somebody, avoiding triggers is enough. It's not enough. But somebody, if you know that this involves keeping like a symptom diary, may help in this process. And if you know the triggers, that means you can know how to prevent the triggers, like such as avoiding exposure to cold, including cold air, including taking cold drinks or taking cold foods or drinking cold water or swimming in the cold water or have in mind that, sorry.
1 minute more, please.
Okay, I'm just finishing. So by preventing measurement, as I previously say, knowing the triggers, so we have to educate the patient that you should be aware of visiting places with low ambient temperature, outdoor leisure activities, household jobs, cold cosmetics procedures, all the frozen foods and drinks before any medical or dental procedures. The treatment of this patient for the first and second lines is the antihistamines, because this medication actually reduce the amount of the histamine in the body, so it reduces the symptoms of hives. So people can take them before they became exposed to the cold or when the hives appear. We give even a higher dose of second generation of antihistaminics. And if you know you're going to be exposed to the cold, consider taking your antihistamines in advance. Another thing is off-label therapy with monoclonal antibody, omalizumab, which is actually targets circulating immunoglobulin E and affects these mastocytes and basophil function. Another therapy is antidepressants and immunosuppressive drugs, but it's very limited because they have potential toxicity and low level of evidence. Antibiotics, and what I mentioned is this EpiPen that is not presented in our country, but another thing that we have to mention is the second part of applying not only not only intramuscular injection as EpiPen, but there is a trial of sublingual application of epinephrine. So I think we are on the right way for shortening the period of applying this drug in order to stop the sign and the symptoms of anaphylaxis, but also sometimes the patient doesn't know how to do this intramuscular injection, or it's needle phobic. So we are on the right way maybe for this sublingual medication in order to stop the sign and symptoms of anaphylaxis. And I will finishing here that we always say as a common recommendation for other types of hives to use cold compressive in order to stop the itching. So this, for people with cold hives, should not use this method. For immediate symptoms relief, they can try topical anti-itch creams and topical application of capsaicin, prevent cold-induced urticaria responsible. And you can also find in the treatment a new drug that is being developed which is actually immunoregulator spleen tyrosinase kinase, and rilonacept, which is interleukin-1 blocker. And another option is cold desensitization that I really don't prefer because it can make cold-induced anaphylaxis. So as much as you can, it's impossible to avoid cold, but we as a doctor, we have to say that thermal insulation is important. So wear warm clothing, gloves and warm shoes and socks, and please protect the areas which is unprotected, like the face, with fatty creams. So thank you.